So once again, my name is Melody Myers. I'm a 2016 graduate from Mizzou, and I'll be moderating tonight's Q&A. Once again, thank you, Dr. Rao, for taking some time out your schedule to just kind of tell us about like your experience on the front lines of healthcare during this pandemic. And just a huge thank you to everyone who's joining us and who's submitted a question. And just as a note before we get into it, we're going to end the Q&A right before 7 p.m. so that everyone who can participate in the nightly cheering of New York's first responders that happens at 7 p.m. So we're going to go ahead and dive right in. Megan, can you first just tell us about your role in the hospital right now and what you're seeing during this outbreak?
Sure. So I finished my medical degree at Mizzou in 2012, and that led me to an internal medicine residency in North Carolina. And then I had the opportunity to move to New York City in 2015, where I completed a geriatrics and palliative care fellowship. So geriatrics is older adults, mainly those above the age of 65, and then palliative care is for people with chronic illnesses or severe illnesses, symptom management, end-of-life planning, and even some hospice work. So after fellowship, I was lucky enough to stay in New York City, and I'm working with New York University, their School of Medicine, and for their hospital system. So prior to COVID, I was doing an outpatient practice with older adults, so for the geriatrics, and then I would rotate in the hospitals doing some palliative care. When the coronavirus outbreak happened, we had a huge influx of patients. I think people may have seen this in the news and the media, where the emergency rooms were flooded with patients. Patients were coming into the hospital, and what that resulted in was opening up additional hospital beds for patients who are infected. And what I was called to do was the New York NYU's Langone Orthopedic Hospital. It was basically closed because of elective surgeries, and that left space for additional patients. So I was sent down to that hospital, and we are currently seeing coronavirus patients and those now who have actually had kind of a prolonged hospitalization. In the beginning, it was people who were earlier on in their illness. Now we're starting to see people who have had kind of a longer course. And so that's where I've been now since March. And we're just kind of taking it day by day and trying to work with how the patients are still coming in.
You mentioned that when you first started, it was people who were kind of showing the early symptoms of the virus. I know one thing that's kind of been going around is in terms of like the number of cases here in New York falling. Are you kind of seeing that in the hospitals as well, or are you kind of still seeing that steady number of people coming in each day?
We're definitely seeing that first wave of patients that I think you're hearing about so much is that first big wave of patients is slowing down. We're not seeing as many patients having to come to the emergency room. We're not seeing as many patients having to be admitted to the hospital. I think that partially that's probably because we have done all of the social distancing. People have been very cautious with who they're in contact with or not. So I think that's been really helpful to slow that wave down and allow the hospital to free up some more of the space for those who keep coming in.
I was going to say, what has been like the biggest challenge for you? Because you're on the front lines, you're seeing this stuff every day. So what's been the biggest challenge for you in terms of going into work during this pandemic?
I think the biggest thing, and I think this is shared with many people, even across the world, is the uncertainty. So as a physician and treating patients, especially with this novel virus, when we first started, it wasn't clear what some of the lab markers meant. It wasn't clear what symptoms are something that's coronavirus or is it something else. I think recently in the news, there has been a lot of information about things from blood clots to strokes that when we started this 6 weeks ago, we didn't know that information. We didn't know that that was a characteristic of this virus. And so for me, I think one of the biggest things has been the uncertainty and then learning as we go. And I think also research has been, some of it has been better than others. And so then trying to kind of go back to those skills of, medical school was always evidence-based research. So now with so much information coming out, I think it's going back to what do we need to, what is the foundation of the medical care that we need to give to patients while still being cautious with we don't know exactly what's next.
And you're talking about in terms of treatment for patients. Obviously, there's not like a vaccine or there's not a drug yet. So what are some ways that you guys have kind of like been treating patients who have come in with the virus?
So with the patients who come in, there's varying symptoms and degrees of how ill people are. New York, NYU has been really amazing in the fact that they've really pulled together the research and had the resources to actually do some of these different research trials on some of the different drugs that have been out there, everything from the azithromycin and Plaquenil to some of the newer medicines, such as the IL-6 inhibitors, or even some of the other new kind of medicines you're hearing in the news. I think one of the cautious things, though, for even providers is, again, try not to harm the patient while we're still trying to treat them, and making sure that we are doing things safely in treating them.
And I'll go ahead and get to some of the questions that a couple of our people who are on now submitted to us. So one of the first questions, it comes from Susan Combs. She's a 2001 graduate from Mizzou. And she says, my husband and I live in New York City, and we both tested positive for COVID on April 15th. My husband never had symptoms, but I have recovered, and we both tested that we have the antibodies +1. There are also options of +2 and +3. Just curious what those mean and if we are truly immune from getting COVID again.
I think that's, again, part of this uncertainty that everybody is trying to figure out, especially in the medical community, with things such as antibody testing. We've realized that there are lots and lots of people who have never had any symptoms at all and had no idea they were even exposed. So with the antibody testing, we're seeing that's becoming much more available in New York City. Just right at the end of my block, there's an urgent care that's being able to do it. So with the antibody testing, what that means is that we don't know what level of antibody now is going to mean that you're immune. And the other thing with the immunity is that it's so new, we don't know how long this immunity is going to last. I would always, advice I give my own family members is even be cautious. Just because you may have been exposed or just because you have the antibodies, still be cautious with this because we don't know exactly what those levels mean or what will qualify you as being immune. That's still in the process of being figured out.
I was going to say the next question, it comes from Emily Rao, 2010 graduate. She asked, how has your time at Mizzou and in the Midwest informed or influenced your experience during the pandemic and how you approach patient care?
That's my sister. So hello, Emily. I think one of the things, being somebody who comes from the Midwest, or have even being somebody who is treating these patients, and I did a lot of some of my medical school rotations in rural Missouri. I think that one of the things now bringing into this big New York City, this big area, is that really working on some of the things when you don't have everybody at your availability or you don't have people coming in to the bedside. I think really trying to be creative in some of the ways that we're able to communicate with patients and their families and able to connect them. I think that that's something that's even more important. And I think that's something that even if it's the telephone call or even if it's somebody kind of video chatting in, I think that's been really helpful. I also think that just the Mizzou network, it's been a really great experience being in touch with some of my fellow medical school colleagues. Some of them are in Texas and then being redeployed other places. We've been talking and kind of catching up and figuring out what have you been seeing, sharing information. So I think that's also been a really neat experience that I definitely have had because of Mizzou and then because of the Midwest.
Nice. Our next question, it comes from Anders Mellon, who graduated in 2012. He said, given your focus on care for the elderly, do you think there will be permanent, lasting changes to the rules and processes for how next of kin will visit their elderly family members in hospices or hospitals as a result of the coronavirus, even after the virus hopefully ebbs a bit?
So I think that coronavirus, one of the things that it has done, and I think it's one of the big things that we're seeing, is that it has put a lot of the spotlight on patients who are now at the end of their life. Many of them have been unexpected. And I think what it's been showing us is that we do need to work on some of these ways to communicate with patients. I think that it's hard for each of the different hospital systems. I think they have their own policy. I can only speak for where I am, but we have definitely made exceptions for patients who are at the end of life, who are going to be able to come in and see their loved ones if they are at the end of the life and have a visitor that way. I think that also the state of New York, they have put in their own regulations with visitor policies and exemptions. And I think it's really showing that this key kind of part of life is really important to not only patients, but their families and who's there with them. So I think that moving forward, we're going to see some more thought and discussion about how do we best treat people when they're approaching things such as the end of their life. And I think we're definitely going to see a lot more based on what we call advanced care planning. So in New York, I encourage everybody who's here to appoint a healthcare proxy. A healthcare proxy is something that you don't need a lawyer for, you don't need an attorney. This is something that you then appoint who you would want to be your medical decision maker to voice your decisions if for some reason you couldn't speak. And I think this is really important because it gives a go-to person and somebody who can then express what you would want. They don't necessarily make the decision for you. They should be voicing what you would want. So I think we're gonna see a lot more people kind of pushing for people to fill out these advanced directives.
Great. There's another question, one second. So Brian, who's on the call, he graduated in 2014. He wanted to know, what do you think people should know in terms of going to the hospital? So a lot of people have expressed fears in terms of going to the hospital, with something that's non-COVID related in terms of, possibly getting the virus. What should people know about that?
So when somebody is going to the hospital and going to the emergency rooms, a lot of the recommendations, especially in the first wave, were if you are having some symptoms, milder symptoms such as fever, if you're having some cough, if you're having some muscle aches, assume you have the virus and try to stay home because the emergency rooms are so overwhelmed. I think with people, if you are having any symptoms where you're having trouble breathing, you're having that shortness of breath, those are really the big symptoms we're saying that you need to come to the emergency room and get evaluated or seek care at a medical facility to make sure that your oxygen levels are okay in your blood. I would also say that we have seen, because of coronavirus and because of the fear for coming to healthcare systems, we've seen a lot of people who are not coming for regular things, such as heart attacks, such as strokes. People are really avoiding hospitals because they don't want to get exposed to the virus. I think talking with people and even some of my older adults saying, if you're having symptoms and you're concerned you're having a heart attack or stroke, that is very important. You still need to seek medical care. And those are certain circumstances where you need to go. If it's something that's perhaps more routine, such as your quarterly podiatrist appointment, I would say that can probably wait. So I think it's really just trying to figure out how the severity of the symptoms are.
That's great, because I know a lot of people have been wondering that same thing. Is it worth going to the hospital? Like if someone, I don't know, like breaks their arm or whatever, like when should I go in? Because a lot of people are nervous about, getting this virus because it's so easily contagious. So thank you for clearing that up for us. Another question, obviously, when this virus first broke out, a lot of media coverage was on the lack of protective equipment for people who are on the front lines. Have you seen things get better in these last couple of weeks as the virus has gone on in terms of, people getting that protective equipment while working?
So this is, again, something that has been very health system dependent on how they have been doing with their personal protective equipment. One of the things that I've seen is where we used to perhaps wear one of the N95 masks or the surgical masks, you would maybe wear those into one patient's room and then you would dispose of it. You may not need it for any other patients. I've seen that we are reusing those. So we are having those, wearing them for 3 or 4 days or even a week, and we're able to get new ones. I think that as the supply chains are catching up and they're ordering more, I've been very lucky in where we are, or where I am, that we have not had a shortage of the appropriate PPE. I think that there's always making sure we have to protect our staff and making sure that our staff are protected so that we can then continue to treat patients. Even with the protective equipment, we have definitely seen that this virus is lots of places. So we have still had many staff who've been out sick because of the virus, and we've kind of had to be working with that too. Again, we don't know where people are exposed. New York City is kind of a big populated place, so it's hard to tell where exactly people were exposed. But we're trying the best that we can to make sure that if somebody doesn't feel comfortable because they don't have the right PPE, making sure that they can get it.
Kind of following up on that question, because that was another question that actually Anders submitted as well. How do you think this is going to change the routine for hospitals in any way going forward? Because like I said, this is a virus that's very contagious. It seems more severe, obviously, than the flu and other things. So how do you think this is going to change the way that hospitals approach PPE in the future?
I think that we're already seeing some of these things. I think you're even seeing them in the regular places such as your grocery stores, in the bank, even the post office, and you're seeing it in healthcare systems as well. I'm seeing a lot of plexiglass being put up, so the barriers, whether you're checking in or registering, so putting that barrier, having people screened before they come into the health system, making sure they don't have any fevers, if they're just coming as a visitor, or if they're a patient, if they are having a fever, moving them to isolation. So for the health systems, I think that you're really going to see more attention to looking at where do these sick patients go, how do we prevent it, here's a mask. And then protecting your providers, I don't think that we're going to get rid of masks or shields, face shields anytime soon. I think that we'll probably continue wearing those in the office. I think that this coronavirus pandemic and outbreak is really going to revolutionize telemedicine, something that we've seen across the country, people having to ramp up their telehealth systems, whether that's through video visits or telephone visits. I think that that's something that for patients, that's going to be something that they want to keep. It's much more convenient to have that phone visit than perhaps going into the office. So for some of more of the routine things, I think you're going to see a bigger demand for televisits and those video visits. So I think that's going to really change how our healthcare system is going to work. I also think that'll change some things with health systems, especially in New York, when you're thinking about space as an issue. If you're able to do things such as video visits, that makes it more accessible for some people.
The next question I have, obviously, like with myself being in like the media and journalism, what do you think, as a doctor in the middle of this, what do you think about media coverage of the outbreak? Is enough being done? Is too much being done? Just kind of what's your take on that?
I think that it's a really hard balance because there's so many different variables between health systems, between locations, between different people, and the variability of the virus itself. And I think that I will say that I will watch the nightly news. I will watch the morning shows before I'm getting ready for work, because these are things my patients are watching, and this is the information they're coming to me with and they're asking about. I think that there is a balance between reporting the story for what it is, and I know we have to balance viewership and things like that. I think that it's been giving a good picture of the happy stories, and also saying, look, these are some of the real kind of issues and pitfalls that we have in our health system, whether that's from nursing homes or potential ventilator shortages, things like that. I know I'm probably speaking to a lot of media people on the line. I think that one thing I've just seen, again, I've watched a variety of different channels here and there, would just be sometimes who is the expert that's talking. I think that's always kind of a big thing when I'm watching, when I'm kind of listening to a story and credibility for a story. If it's somebody who's the first year out of medical school and they're acting as an expert in a field, it gives me a little question versus somebody who is very experienced, has been doing this as a specialist, that type of thing.
Great. Just have a few more questions before we get ready to wind down. So I know it's been, obviously pretty hard in terms of having to go in every day, dealing with this during a pandemic. Are you still finding any rewarding moments during your time on the front line during this pandemic?
I mean, there's still an incredible amount of rewarding. I think that there is definitely a lot of sadness and heartache that goes into each of these cases. I think trying to focus on some of the really bright spots. Even today, a gentleman who, I think this is his 40-something day of hospitalization, he was in the ICU, he was on a ventilator, he was doing the prone, which means you flip them on their stomach to try to help with the air movement. And he finally came to where we are, and today was the first day that he was able to video chat and see his daughters and to see his wife. He had had a couple phone calls, but he'd been confused, and so today he was able to just see his wife on FaceTime. And I think that's something that just is incredibly heartwarming and touching, just to see them connected and hear them saying, I love you. It's been so exciting to hear you speak. For a lot of families, they've dropped their loved one off at an emergency room and they haven't been able to see them. And so even those little moments like that, I think, have been very rewarding, and not just for me, but for, I think, all of the staff who have seen it.
My next question, what are some things that you think people could do to show their appreciation or help healthcare workers during this hard time?
The response from New Yorkers has been, I mean, truly, truly incredible. And I think that one of the biggest things that people can do in New York especially is just please try to maintain the social distancing, and please try to maintain and prevent having, again, that big influx of people who coming in and we don't have enough beds for them immediately or things like that. I think that's one of the biggest things people can do, because it was really, really hard when people don't know that they have any symptoms or know that they're infected, and those who are vulnerable then get exposed, and it's a very different trajectory for their illness.
And in terms of just showing appreciation, one thing obviously New Yorkers have been doing is cheering outside their windows at 7 p.m. Every night. How do you feel about the nightly cheering? Is it encouraging? Do you look forward to it? What are your thoughts?
So I think the first time I heard it, I actually, in the beginning, we were kind of working long hours, and then it started, and the first time I heard it, I was actually finally walking into my apartment, and I kind of initially was like, what's going on? You hear a lot of banging and cheering, and then I realized it. And it's something that's very touching. I think one of the hard parts is also that we're doing, for me, this is doing a job, and a job that I've liked doing. I don't know if it's something that needs all of that extra, but then I hear it, and I know that we have the support of so many people, and it's very touching. And I still will go to my window, or if I'm out on the street or something like that, and applaud, because I think there's so many people that goes into this, not just the doctors or the nurses. It's everybody from the security personnel to the janitorial staff. Everybody makes this happen. So we couldn't do it without the big team effort. So thank you for anybody who's done the 7 o'clock applause. It is very special.
And then a final question, just kind of like a broader question outside of just healthcare. It comes from Todd McCubbin, I believe, graduated in 1995. He's also the executive director of the MAA. He just wants to know, what's it been like living in New York during this time for you?
So it's kind of, I think during this time, I think one of the biggest changes as I moved from Missouri to North Carolina and then to New York, the pace of things is so much different in New York before the coronavirus outbreak. And used to seeing people, used to having people taking the subway, those type of things. I think the biggest change is just, it's almost as if it's kind of a ghost town. It's kind of like Columbia after the semester lets out and you're there in the summer. You don't have lines at different places. There's not all your favorite spots are open. So I think the biggest change has really been that there's not people around. And then in New York, we live in smaller spaces. And I'm really fortunate that Central Park is not too far away, so I can get some greenery. But I think being in the apartment all of the time has been a very big change. And that's something that I think once we start going back out, I would love for the city to wake back up, where we can still go out and see people and socialize again.
I think a final question to just kind of wrap it up, because I'm always about, optimism during this hard time. I've been asking people, like, what's the first thing you want to do or the first place you want to go after this pandemic is over?
I actually want to go back to Missouri to visit my family. I've had numerous vacations. I was supposed to go back for numerous occasions, and all of my flights have been canceled, and I don't think anybody would actually want me to fly back right now. But as far as kind of a fun thing to do, I would really like to get a pedicure, and that's something that is just not really on the table right now. So we're just making do. I'm not going to the beach anytime soon, so I guess it doesn't matter.
Good. I'm with you. Like I said, I'm looking forward to hopefully, when this is over, and like I said, hopefully the number of cases will continue to decrease. But I just want to say thank you again for taking time out of your busy schedule to join us. We really appreciate it. I'm going to go ahead and wrap this up because, like I said, I want to give people enough time to get to their windows and cheer for Megan and other healthcare workers. I just want to say thank you to everyone who joined via Zoom. We appreciate it. Thank you for submitting great questions, and hopefully we can do something like this again soon in the coming weeks. And if you guys have any ideas about events, virtual events, obviously, during this time, definitely let us know. Thanks again, and thank you, Megan.
All right. Thank you. Have a good night.
Thanks, you too.